Hello and welcome to the podcast. I'm Kelly O'Leary, a Year 12 AIF student who is interested in liver transplantation. I find it fascinating that transplants can make such a significant difference to a person's quality of life and the ways this can impact the patient and also family and friends. For my AIF project, I have learned more about liver transplants and their effects on those involved, with a specific focus on patients in Australia. This podcast aims to help those impacted by liver transplantation by providing information about the process and what it can mean for the people involved. In this episode, you will hear excerpts from interviews with medical professionals and liver recipients. My learning has enabled me to understand the liver transplant process from a doctor's, nurses, patients, and family members' perspective, and I hope you will also benefit from listening to their viewpoints. So, what is the liver? The liver is the largest internal organ of the body, located in the right upper quadrant of the abdominal cavity. The main function of the liver is to filter the blood from the digestive tract before supplying it to the rest of the body. It also aids metabolism, digestion, immunity, and the storage of essential nutrients. These vital functions mean that a person cannot survive without a functioning liver. There are several reasons why someone may need a liver transplant. In South Australia, most liver transplants are performed for patients with chronic liver disease, which leads to liver failure. I recently interviewed Dr. Yuling Neo, a liver transplant surgeon at Flinders Medical Centre, the only hospital with a liver transplant unit in South Australia. Here's what she had to say about some of the causes of liver failure and how this might affect the patient experience.
Well, the majority of liver transplants are done for chronic liver disease, where the patients have had an insult to their liver over many years, and after a long time, the liver starts to fail, and eventually the patient's life is potentially shortened because of liver failure.
Yes.
There are various causes of liver failure. The most common ones that we see are excessive alcohol intake, and as well as hepatitis viral infections such as hepatitis B and C. And more recently, we have found that there's an increasing incidence of liver failure secondary to fatty liver disease in our community with increasing obesity. So, essentially, hepatitis B and C have reduced in number because of effective drug treatments, but there are still some cases where they do develop liver failure. In terms of how the different types of liver diseases affects the patient experience, I don't think it really has a significant influence on the patient.
Children requiring a new liver have congenital conditions. In a publication by Professor Jeff McGaughan and Professor Stephen Munn, they state that paediatric liver transplant patients in Australia most commonly have congenital biliary atresia. This life-threatening disease occurs when the bile ducts fail to develop in utero, and therefore the liver cannot excrete toxins and waste products in bile. In Australia, there are 3 paediatric liver transplant units in Sydney, Melbourne, and Brisbane. Consequently, young children living in other areas must travel to one of these cities if they need a liver transplant. The supply of human organs falls far short of the demand. Therefore, medical professionals must make decisions about assigning organs to those in need of a transplant. For liver transplantation in Australia, there is a waiting list, where each person is scored according to the MELD or PELD score. MELD stands for Model for End-Stage Liver Disease. In adults, a MELD score greater than 15 typically indicates the need for transplantation. PELD is short for pediatric end-stage liver disease. In children, a PELD score above 17 usually indicates the need for a transplant. Organ donors are often young, otherwise healthy individuals who have suffered brain death. They must have a healthy and suitable liver for it to be donated. In Australia, doctors only obtain a patient's organs if they are a registered organ donor. An organ donation nurse and doctor also consult the donor's family for final approval. During my interview with Dr. Neo, we discussed the MELD score and assigning organs in greater detail.
The score is to reflect how severe the liver disease is. So the higher the score, then the higher the risk of the patient dying from liver failure. So those patients with the highest score gets priority when an organ becomes available. But whether an organ is suitable for that particular patient depends on the blood group.
Yes.
So the blood group has to be compatible. So let's say the donor is blood group A, and the recipient has to be either a blood group A or AB. It has to be compatible.
Yes.
So that's how the organ is assigned to the recipient, based on blood group and also based on how bad their liver failure is.
And does the MELD score take into account things like their age?
No, age is not is not a factor that is taken into account when we allocate organs. We do, however, look at the size of the donor and the size of the recipient. If you have a very big, tall donor, they generally have bigger livers. And if the recipient is very tiny, then the liver wouldn't fit. So we have to have a size match as well.
Interesting.
In New South Wales and Queensland, the option of living donation has also been adopted. Since the liver can regenerate lost tissue, part of it can be donated by relatives, such as parents or children of elderly people. Dr. Neo told me that she doesn't feel there is enough need to warrant studying living donation in South Australia. As such, South Australians who would like to explore living liver donation can travel to New South Wales or Queensland for that possibility. According to Donate Life, all major religions, including Christianity, Islam, Buddhism, Hinduism, and Judaism, support organ and tissue donation as an act of compassion and generosity. Further, donation specialists help donor families make arrangements to facilitate religious and cultural requirements. Next, I want to talk about lifestyle changes. Some of the most significant lifestyle changes pertain to individuals who receive a liver transplant due to alcohol-related disease. Now you'll hear more words from Dr. Neo relating to the lifestyle changes these patients must implement.
It is absolutely necessary for them to stop drinking alcohol, and they actually have to go through a long process in order to be eligible for liver transplants.
Okay.
They have to have psychological counseling. They have to prove that they will not relapse into their drinking habits again. And they also have to be totally abstinent from alcohol for at least 6 months with regular surveillance.
Okay. Thank you. That was very insightful.
What can a patient expect about their liver transplant operation? In this operation, surgeons replace the diseased liver, called the native liver, with a healthy liver from a donor. The whole process from when the recipient arrives in the operating theatre and receives anaesthesia to the completion of surgery can take anywhere from 6 to 10 hours. On average, it takes about 7 hours. Not long ago, I spoke with Libby John, a liver transplant coordinator and nurse at Flinders Medical Centre. In response to a question about the length of patient stay in the intensive care unit, called the ICU, and on a ward, she said,
"It's a long surgery, and after the operation, we don't immediately wake people up and take them off the breathing machine. We keep people sedated and asleep after the surgery with the help of the breathing machine whilst they're sedated, and they are transferred to the intensive care unit. And they're observed very closely there by the doctors and nurses. And after about, on average, 12 hours or so, if everything seems stable, they'll turn the sedation off, the medication that's keeping them asleep, and remove the breathing tube so that they're awake and breathing on their own. The length of time that they remain in the intensive care unit after the surgery depends a little bit on their progress, so it could only be 24 hours. On average, it's probably 2 days. Sometimes it can be longer if they're not quite stable enough yet to head up to the ward.
And then how long would they typically spend in the ward?
On average, it's 7 to 10 days, or in fact, that's 7 to 10 days from when the day of surgery to going home. Yeah. So if they only spend 2 days in ICU, there might be another 7 days or so on the ward. Yeah. If all goes according to plan. If they have any complications, obviously the stay could be later, or longer, I should say, sorry. So it could be anything from 7 days to sometimes people stay for 3 months if they have serious complications, but that's not common. Not as common. Yeah, normally within 2 weeks we try and get people home.
In terms of the abdominal scar, patients can expect to have quite a large scar following their operation. The incision begins just below the breastbone and goes all the way down to just above the belly button. The incision then travels towards the patient's right-hand side, finishing at the bottom of the rib area. So liver recipients will be left with a sort of an L-shaped scar. I will now discuss the surgery, including pre-operative care, the operation itself, post-operative care, and risks. In terms of candidates for liver transplantation meet a liver transplant team. It is called a multidisciplinary team because there are various people involved. This team includes liver transplant surgeons, doctors called hepatologists who specialise in liver disease. Hepatologists play a key role in the team. Anaesthetists, liver transplant coordinators, social workers who are involved in the workup of patients, and other team members such as dietitians. Candidates must have a full evaluation before being placed on the waiting list. The transplant team conducts several tests, including psychological and social evaluations. These tests are performed on the patient, if they are old enough, and their family. Patients with previous alcohol addiction need to undergo counselling and psychological clearance. Blood tests to help find a suitable donor match and assess the patient's priority on the waiting list. And diagnostic tests, which may include x-rays, ultrasounds, and liver biopsies, which check the patient's liver and overall health. The patient receives a phone call when a suitable donor liver becomes available. This call can occur at any time, possibly days or years after placement on the waiting list, so they should always be ready. Patients must go to the hospital as soon as they receive a call to be prepared for surgery. Now moving on to the surgery. You may be wondering, what actually happens during liver transplant surgery? Well, after all the preparation takes place and the patient is in the operating theatre, the surgeon makes an incision in the patient's abdomen. The surgeon then carefully separates the native liver from nearby organs, structures, and blood vessels. At the same time, another team of surgeons gets the donor liver ready for transplantation. Once the native liver is removed, the donor liver is attached to the patient's blood vessels and bile ducts. The surgeon closes the incision with stitches or surgical staples, and finally a sterile dressing is applied. Throughout the operation, a member of the transplant team advises family and friends on how the surgery is progressing. Now the post. Short-term recovery is all about ensuring the transplanted liver is functioning properly without rejection and the rest of the body is in good health. Following the transplant, patients will experience some pain because, with a large incision like the one previously described, surgeons must cut through layers of muscle to reach the abdominal cavity where the liver sits. There will be discomfort, particularly when the patient moves, but the team of anaesthetists help manage the pain. The anaesthetists assess each patient's pain level and prescribe appropriate medications at suitable doses accordingly. This pain relief is administered through a drip and oral tablets. Ideally, the anaesthetists want recipients to be pain-free, and they try their best to make that happen. Once patients go home, their health is monitored in the long term. So, post-liver transplant patients visit the liver transplant clinic to see specialists and have routine blood tests, in particular liver function tests. Liver recipients also undergo ongoing screening to ensure they don't have any complications, such as other types of cancer, diabetes, or high blood pressure. Medical professionals look after their whole body, not just the liver. Moving on to risks now. Transplantation has the potential to save lives and restore health. In saying that, there are risks associated with the operation. Possible complications following liver transplant surgery may include rejection of the new liver by the body's immune system, bleeding, sepsis, primary non-function, where the new liver does not function, hepatic artery thrombosis, which occurs when a clot forms in the artery to the liver. In this episode, I will just focus on rejection. Despite considerable improvements in outcomes following liver transplantation, organ rejection remains a common complication. According to Dr. Sukhar Go at Austin Health Victoria, up to 30% of recipients experience an episode of acute rejection within the first year. Rejection is a normal reaction of the body's immune system to foreign tissue. When a new liver is placed in the body, the immune system recognizes it as a threat and attacks it. To help the new liver survive, recipients must take anti-rejection medication. These are called immunosuppressants. Immunosuppressants weaken the immune system's response, and recipients have to take them for the rest of their lives. If patients are found to have abnormalities in their liver function tests, they need to first undergo non-invasive investigations. Non-invasive modalities include ultrasounds, computed tomographies or CTs, and magnetic resonance imaging or MRIs. If required, they will then need to have more invasive tests, such as liver biopsy, a procedure to remove a small piece of the liver tissue for examination, and ERCP, which stands for endoscopic retrograde cholangiopancreatography. This segment is dedicated to the role of nurses. Nurses play an important role in monitoring patients. They educate patients and their families about immunosuppressants and all the other transplant medications so that they can self-medicate safely. Nurses also arrange blood tests and check the level of medication in the patient's blood from these tests. In addition, Australian hospitals provide a 24 hours a day, 7 days a week on-call service. So if patients are unwell at home, they can speak with nurses even after hours or on weekends. The nurses help find out what is happening and determine whether the patient needs to come into the hospital or whether their complication can be managed at home. Here's Libby John, who doubles as a liver transplant nurse and liver transplant coordinator, explaining her role as a coordinator.
Once we put someone on the transplant waiting list, we have to wait for a suitable donor liver to become available that's the right blood group and the right size for them. And so that's part of our being on call 24 hours a day, is that if there is a donor liver somewhere in Australia, we would get called and offered that liver if we're sort of next on the rotation of getting offered a donor liver, and then we would have receive all of the information about that donor liver so that we can work out whether it's a good healthy liver to transplant. And once we've got all that information, we'll call the liver transplant surgeon that's also on call as well, and provide them with all that information so that they can make a decision about whether that liver can be used, and then we look at the transplant waiting list and see who the best match is in the waiting list. Mm-hmm. And then once we've done that, and we decide that we're going to use that donor liver and who the recipient is going to be, then we have to organise to send a team of surgeons to wherever the donor hospital is to do the surgery to remove that.
Medical professionals aim to give patients a high quality of life after their liver transplant. Many recipients can enjoy activities they couldn't do when they were sick with liver disease. Some female liver recipients even go on to start families. Sometimes patients experience complications, and it is a matter of managing these complications so that they can have the best quality of life possible. Regarding financial impacts, patients with chronic liver disease resulting in liver failure may be too ill to work. Consequently, they cannot earn an income while they are sick. A liver transplant will likely restore their health, allowing them to return to work. Medicare covers the cost for liver transplants and any follow-up investigations.